Chicago has long time been a hub for breakthroughs in medicine, but the amount of people dying from cancer here shows us not everyone benefits equally. If you live in one of the city's low-income, predominantly Black or Latino neighborhoods, you don't have the same access to or quality of care. Tonight, our Audrina Sinclair examines the problem and who's helping.
The sauce that I'm gonna put in here has like zucchini and eggplant.
All from Janella's backyard in Roseland.
It's really good too.
She grows it, she cans it.
Shelf-ready food for at least 6 months to a year. It's wholesome food that I grew myself. It's my responsibility to make sure that I stay healthy.
And speaking of that,
where are you at now in your journey?
My prognosis is well. My last scans were clean.
a year after finding a lump in her breast and having no health insurance.
So you hear all the time about, breast cancer, screenings, free screenings, availability. But when I needed it, I couldn't find it. I called around for 2 weeks and I could not find anything.
A friend told her about the nonprofit Equal Hope.
They made sure that I got everything that I needed.
Starting with a mammogram and biopsy at Rush, where doctors diagnosed her with triple-negative breast cancer.
Someone went to every appointment with you. How many appointments are we talking about?
I had 17 rounds of chemo, MRIs, and you have CT scans, and you have bone scans, and you have bone density scans. And then after chemo, you have radiation, and radiation is every single day for 4 to 5 weeks.
Her nurse navigator, Rita, was there, then and now, and the cost all covered.
So this is a state-funded program that allows women to access care at no cost, which is why she didn't have to see any of those bills.
Paris Thomas of Equal Hope works to fight Chicago's cancer care disparities, helping 1,800 women like Janella right now with breast or cervical cancer.
We serve the communities on the west and south side of Chicago, primarily those that are Black and brown. And usually those who are considered under-resourced, disinvested in.
And this map shows those are the neighborhoods where the most people are dying from cancer in Chicago. The darker the blue, the more cancer deaths, and all minus one community are on the south or west side.
We know that we have to intervene in this community. There's a problem here.
Intervening for patients treated at safety net hospitals in their neighborhoods. These are usually under-resourced facilities with out-of-date equipment, lower staffing, and limited hours.
Let's say capacity. Maybe they don't have a full-time mammogram tech and they're only able to see women once a week. So we know that we now have to pivot and try to move our populations to other facilities.
And this study looked at those barriers to care in Chicago's under-resourced neighborhoods and found specialists on the south side are treating 3 times as many patients as on the north side. We're talking 1,000 patients to every 1 doctor on the south side of the city. So Thomas is hyper-focused on these disparities to help people like Janella get the cancer care they need.
I don't know where I'd be without, without that help, that they provided.
In part 2 of her story, Audrina digs into the disparities and ways to tackle them, including a look at a new cancer center coming to Hyde Park. That's tomorrow night at 10.